Well, hello and good morning. I'm Simon Beardsley from Lincolnshire Chamber of Commerce, and a very warm welcome to this ChamberConnect webinar. I'm here as one of your hosts this morning, which is part of our Leading Wellbeing Through Challenge series. And this morning we'll focus on enabling positive change and resilience for the wellbeing in our workplaces. Thank you very much for joining and connecting with us virtually today. Our ChamberConnect series have replaced our normal face-to-face event, and we feel they've become a really important tool in terms of being able to connect and inform. I'd just like to make you aware that today's webinar is being recorded. It will be available to rerun on our website shortly, and we'll also send some follow-up links in the communications that we send to you after today's webinar as well. So just a run through in terms of what this morning will look like. I'm shortly going to hand you over to Professor Dean Fathers and Dr. Ian McGonagle. They'll focus on building resilience, followed by Rosie Green, who will pose some questions to Professor Fathers and Dr. McGonagle. We also will ask for some questions from you as well, and I'll tell you how to do so a little bit later on, but there's an opportunity there for you to join in the discussion. We also have at about 10:20 a panel discussion that will focus on the well-being of our people, facilitated by Mark Hammond, and we'll have guests there of Professor Fathers, Dr. McGonagle, Ben Heaver from Streets Heaver, Reverend Alan Robson, and also Rushi Agarwal from the University of Lincoln as well. Again, an opportunity for questions and answers after that. And it's very much meant to be an interactive session. I'll shortly be handing you over to that first session, but in terms of how to get involved, if you would like to do so, on the right-hand side of the screen, if you press on the chat part of the Zoom bar at the bottom there, you'll find the ability to raise questions. They can type them in the bottom and we can see them, and we can come to those at the relevant parts later on this morning. We can also involve you by letting you ask the questions yourself directly. So if you want to pose those questions directly to the individuals that we have taking part today, happy for you to do so as well. We expect this morning's session to run for about 90 minutes. So I think we're all good to go now. So I'm going to hand you over first to Professor Fathers and Dr. Ian McGonagle. Are you there and able to take the reins?
And hopefully I'm sharing a screen with you shortly, which you will be able to see.
Yes, we can.
Can you see that now?
Yes, we can.
Wonderful. So good morning, welcome. My name's Dean Fathers, and despite the fact that Simon has kindly introduced me as Professor Dean Fathers, I'm anything but an academic. Most of my life has been spent in the commercial world, and I have a portfolio career which spans mainly across the health sector and particularly around mental health. But a number of my private sector roles are in digital and in technology. And I've, over the years, developed a bit of a kind of an interest in academia purely because of the fact that I know that my capability as a board director has yet to be developed and is in need of greater knowledge and more skills. So I'm definitely looking to ways of improving myself. And so in the quest to do that, I've actually engaged with organisations like the University in Lincoln and put together, as a result of over 270 hours of desk research, but more importantly, engagement with over 120 organisations, this synthetic, synthesised model, which I'm going to share with you today. And the fact that this has been created by directors of organisations means that it's relevant and pertinent to what makes an organisation more resilient. And what I'd like to do is share with you in the next 15 or so minutes, three elements of it, particularly that I think are important in answering today's question about how do we make individuals and organisations much more resilient. And Ian will come in on the back of that and particularly pick up upon the elements of individual resilience. I think the other thing that I'd like to do in the next 15 minutes is give you a couple of questions that you might want to talk about later on as well. So as we go through, I'll pose those questions for you. The reason that this presentation came about is that the last time we spoke around resilience, I responded to a question about the new normal, and I posed the idea that there is no such thing as normal anymore. The only normal is transition. And the reason for that is that we as a society are now more increasingly having to be engaged in what is known as a Vuca world. And those of you that haven't heard of Vuca before, Vuca is an acronym which stands for volatility, uncertainty, complexity and ambiguity. And one of the things that we'll actually see as we look out into the external world, that it's having a greater impact in terms of technology disruption, for instance, on the way that we do business. Pre-pandemic, for instance, did we ever imagine that we would be hosting these sorts of events so easily within just a few months? Technological revolution is increasing exponentially, and science is advancing in the way that we actually need to be living on this planet, and the consequence of that is something that will be impactful on all of our kind of businesses. Planetary health and the health of the planet was big as a conversation piece before we went into lockdown. Certainly we've seen as a result of this pandemic a recognition that our own physical vulnerability is actually something that we need to be more concerned about. And, you know, as a result of this pandemic, we've also seen that having the virus slowly disappear, we're left with a second problem, which is the mental health of our workforce and the mental health of our society. We've seen through the pandemic a massive increase in civil re-engagement with the Floyd Blacklight matter situation. Society globally has reacted to that, and we in businesses need to recognise how those sorts of things will impact upon the way that we do business. There's massive leadership challenges around the world as people jockey for new positions. We're seeing new wars, new environmental driven wars because of the environmental change where water and other scarce commodities are actually being the cause of conflict between nations, and it's predicted that those will keep on going, etc., etc. And these are all very wicked problems, and if we try to deal with these wicked problems in a simplistic way, then we will be vulnerable to them. And therefore the first element of this is that we need to be thinking about these global problems much more strategically as boards, and looking to them not just as threats, but also as opportunities. And the London Business School actually, at the beginning of the pandemic, did a bit of research around a number of organisations, and they actually discovered that about 13% of the organisations surveyed actually thought the pandemic was going to be a massive opportunity for them, that as a consequence of the pandemic, life was going to become much more prosperous and successful commercially for them as organisations. And therefore the proactivity of looking for these and connecting the data that we have from all of these different global sources of intelligence is something that we as boards have got to start to think more about. And it's appropriate, we were talking before this meeting, Ben and I, about how the digital space is going to start to become much more important for boards. So artificial intelligence, better use of our intelligence to enable us to think strategically and opportunistically is going to be significantly more important about the way that we add value. And so our purpose as an organisation at this stage is fundamentally starting to be challenged, and we've got to continue to rethink our purpose as boards and to rethink our meaning as boards about how we add value. But what we've also seen in recent years is that that way of adding value has got to become much more virtuous. One of the things that we've been seeing out of the Black Lives Matter is a redress of some injustices in society that people have started to actually talk freely about, openly about, which were ways of being capitalistic in the past, but which are quite clearly not virtuous in today's society. We as a society are becoming much more attuned to the virtues of the world. And, you know, the fat cat business person has been more increasingly pilloried over the last few decades because of the fact that people in society are challenging our right to just make wealth to the detriment of other key stakeholders. And if you actually think about, you know, some of the major issues around corruption around the world, modern slavery and so on, those issues are still really prevalent in today's society, and we've got to start to address them. So the first give is, you know, think more effectively about how do we deal with that Vuca world, and think about what the impact of that is on the resilience of the organisation in order to actually take our organisation and be even more successful in the future. I think the second take that I'd like to pick up is the fact that we as individuals are really vulnerable. Again, this pandemic has proved to us yet again how weak we as individuals actually are, and therefore how vulnerable we are to all sorts of different threats. And one of the things that we've got to recognise is that that vulnerability has a massive cost to society. So when I started this initial research back in 2016, I was privileged to actually meet a guy called Paul Farmer, who spoke at a presentation conference that I chaired about some work that has now been published in his report called Thriving at Work. And in his presentation, he basically identified from his research that in the private sector, around 300,000 people leave work every year prematurely because of poor mental health. So 300,000 people never to go back into a workplace, and as a consequence of that, there is a massive cost to organisations. So his report actually suggested that there was about an £8 billion cost to those organisations in finding the replacement, training, re-educating those new people to get them up to the level of capability of those people that had left prematurely. That's an £8 billion cut from the bottom line performance of organisations. He also identified within the process that there was an issue around absenteeism, and the UK has got a major issue with absenteeism, more so than many of our Western competitive worlds. The consequence of absenteeism as a cost to the UK economy, to those employers, was calculated to be another £8 billion or so. And then the third element that he identified that was significant is this issue called presenteeism. And presenteeism is the issue where we all turn up to work, but we don't necessarily go to work fully thinking what it is that we're trying to achieve. Our absenteeism mentally in the workplace, our lack of presenteeism, has a even more significant cost, and that was calculated to be between somewhere like 17 and 26 billion pounds. So that's 33 to 42 billion pounds worth of cost that the UK economy could actually be benefiting from directly into the bottom line of organisations. So if any employer doesn't think that there is a need economically to deal with this, then those facts should help them to focus in on it. Deloitte at the beginning of this year actually repeated that research, and they discovered that the 2017 figures had actually increased by about 16%. And I suspect that if we were to do this again after the COVID crisis, that level of cost would have increased much more significantly. The collateral damage to that, of course, is to all of us as taxpayers, in that those people leaving prematurely and with their absenteeism bring in an extra cost to the NHS of between £3 and £5 billion. They have a cost to the taxpayer in terms of benefits to the tune of another £10 billion. And the lost income from national insurance and various other taxes is somewhere between 11 and 14 billion pounds. So again, another 27 to 30 billion pounds in total there that the UK economy is contracted by, that could actually have been increased. So if we actually address, and Ian will pick up how we might be able to pick up those individual elements of mental health and building personal resilience, there is a significant payback. You know, the cost to the economy and the improvements in productivity that could come from it will actually be well worth going for. And as a consequence of that, the Thriving at Work as a national initiative has been created. The centre at the university that I run has actually now been commissioned by the Midlands Engine to be the local partner on an initiative called Mental Health Productivity Pilot. And those of you that might be interested in mental health, I would encourage you to engage with us if you would be interested through that mental health productivity pilot. The Midlands Engine has a number of products and services that it's keen that we use to help increase our productivity, and those are really important, and Ian will demonstrate why that's important in a few moments. So that's the second element. So we've got this big external environment that must be dealing with the complexities of the external world. We've got this group of individuals who, through our diverse set of circumstances, are unique and different, and we need to be thinking about our own psychological safeness and well-being to enable us to perform well. So what's the role of the leader in an organisation? And that's where this hexagons around the central hexagon actually come in, because those are the six elements, the six things that the research identified boards need to be dealing with, creating the right tools and techniques to enable the individual to not be weathered by inappropriate use of, but to be enabled by successful use of. So, for instance, every one of those six hexagons, if we do them badly as leaders, will create a mental health problem. If we don't give people meaning and purpose, they lose their sense of identity, they lose their sense of passion and motivation, and therefore they actually go on the line. If we don't provide appropriate leadership where we engage and listen to people and work with them on an emotional level as well as a physical level, we are less effective as individuals. If we create work environments which are inappropriate to both our physical and our mental health, then that is inappropriate. And so each of those I can expand on and identify tools and techniques that you need to actually deploy to enable you to actually improve as opposed to destroy the value creation within your organisation. But the system of those must be considered, because what we do quite often is we work those in silos. And because we work them in silos, what we don't realise is that they compete with each other. So whilst we're working on meaning and purpose and we're writing policies and structures and processes, if the two aren't aligned, they will actually contradict each other. So there are a number of examples of where I've actually read through company policies and I've said, isn't the meaning and purpose behind this to do X? And I'll give you a lovely example with the pandemic where here we are, we've all got to work from home. The first reaction in our policy is, our policy says we're not allowed to work from home, we're not allowed to use technology, we're not allowed to share data, We're not allowed to, do all sorts of different things. Do you see why policies are quite often contradictory to the meaning and purpose of an organisation and what we need to do in order to survive? Quite often, strategies are opposed by the behaviours of the people who work within the organisation, and quite often the nature of work is actually culturally insensitive to the different diverse working groups that we've got within our organisations. So the paradoxes of each of those hexagons need to be explored, and we need to actually think about how we actually create value. And if we can look at the equation on the right hand side, the Y equation, what I've done there is, it seems to be that the latest trend is to listen to scientists and take their advice. I've tried to be a bit ironic in some regards by creating a scientific formula, which is actually anything but. But the E squared is about engagement and emotional attachment. So if we've got people who are engaged, it's great. But if they're not emotionally attached to that engagement, in other words, we're just talking to them, and we're like the Simpsons dog, which is hearing blah, 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 even though the noise is coming at it in a way which it shouldn't be hearing, just blah, blah, blah. The emotional attachment will actually detach people and prevent them from being innovative. And it's that level of innovation that is the response to the Vuca world that we need each of our individuals to be able to respond to. The equation of innovation within an organisation will enable us to think about transformation and transition as the norm, and therefore enable us to remain fit for the future. And as a result of that, what we'll do is we'll actually get not only increased productivity, but we'll also get bottom line performance as a result of that productivity, which will be measured against a whole series of new measures. So if you actually look at integrated reporting as a concept, which was created out of South Africa as a result of Nelson Mandela thinking about how do we make governance a more virtuous thing within South Africa to address the fear that they had that the money would pour out of South Africa after the end of apartheid. The virtuous nature of governance was important to make people trust that business community to leave their money there, and therefore it was important that they measured all lines of profitability, not just the financial profitability. And at that point, I'll hand over to Ian to pick up a little bit more around the psychological safeness element.
Right, thank you, Dean. I believe I've got 10 minutes, so thank you very much. Thank you very much for the invite to come and speak with you this morning. I hope all are well. Yeah, I've been asked to just talk about sort of maybe this central hexagon, and in terms of CHIMA, which we sort of relate to this notion of recovery in mental health. And that is that sense of the CHIME, I think, stands for connectivity, hope, identity, meaning, and empowerment. But I really, those are only words, really. I guess what we're interested in, or I've been interested in my sort of career, is about, well, what do those words actually mean? What do they mean in terms of the value base from which they stem? And more importantly, I guess, behaviours which are aligned with them. So I'm very much into the notion of quite a behaviourist in many respects in terms of my general approach, because I'm focused, because I think it is in behaviour that we actually see these notions, personified, if you will, and experienced. So what's kind of recovery got to do with sort of the business community, I guess? And for me, there's a really interesting sort of dialogue. One is the sort of our history of recovery in mental health really has been interesting in the respect of it doesn't mean what we would expect it to mean, because it actually came from service users, it came from patients, it came from people who are experiencing mental health difficulties. They were the people who constructed their notion of recovery. So that sense of empowerment, you know, is really interesting. You know, it isn't about necessarily allowing people to take power. You know, it is about encouraging the territory in which people, you can't give power to people, you can only encourage the territory to exist where people will seize power for themselves. And it was really interesting, sort of mental health community, that it was actually not the medics, it wasn't the nurses, it was actually service users who were starting to articulate, well, what does recovery mean for us? And critical within that was this notion of hope, really, that things can be better. And I think that chimes to, if you pardon the pun, with where we are right now in the respect of this sense of needing hope, optimism is a really important kind of psychological construct that we would need to really promote. And the other element, and because without hope, you really haven't got anything. You know, it's a sort of Pandora's box type situation. That's kind of what you need. You absolutely need hope, that sense of optimism. The other thing I think that sort of has resonance for me in terms of business, I guess, is because I'm interested in this notion, like say, empowerment and identity, and what does it mean to be a member of this organisation, to work in this place, to be a part of this team. And my sort of, some of my histories around in team development and thinking about teams as being real good engine rooms of change. But it is this sense of, in terms of businesses, about, you know, well, where's the partnership? You know, where's the leadership, and what kind of leadership are we talking about that will create the conditions in which people will create a sense of identity, will instill a sense of hope, redefine their sense of hope, understand the complexity within which they're working, and create meaning for what they do. As Dean has sort of eloquently and articulated earlier, you know, this is a really interesting conceptual knitted jumper, if you will, of lots of things that are just intrinsically connected, and is it quite right to articulate as being a wicked problem. So I think there's something around sort of leadership that I think I really want to promote, and it is this notion of leadership for values and behaviour. I think it is about understanding that leadership is about partnership and working with others, that sense of connectivity. We will not solve problems on our own. There's no question about that. That really is that sense of being connected with others that will matter. And another really important construct, I think, within this is compassion, and a recognition that actually, you know, this is difficult. You know, Dean has alluded to the concerns about the mental health of the population post this pandemic, and I think, you know, I think we can all share that kind of, like, what kind of society we're going to have, but this notion sort of just being in transition permanently may well be correct, and there is a sense of really needing to adjust. But in that adjustment, there's this sense of, well, we need to be compassionate then. We need to understand, but we need to be compassionate to ourselves in the first instance. The recognition that this is really hard. So again, I would make some links in terms of leadership to this notion of compassion. To be a compassionate leader means to be compassionate about yourself first, to recognize that actually this could be really testing. It could be really hard. It could be a very difficult environment, you know, both sort of economically and also personally. And it's important that we recognize we'll make mistakes. You know, we'll make mistakes. It is about dialogue. And again, if I reference what Dean was talking about in Black Lives Matter, it's really interesting dialogue for me that people are you know, I think for the first time, and I have some background in delivering race equality work at the department, it's really interesting that there's this real dialogue going on, saying, like, you know, almost for the first time, we want to engage in a dialogue, but we will make mistakes. We will get it wrong, but recognize that it's actually that process of learning by making mistakes, by getting it wrong. That's how we really learn. That's how we really change. And I think that's a really interesting sort of dialogue that I'm hearing for very much the first time, really, it feels like, on a scale. So, and I think that some of that is about self-compassion. I think that is about people recognizing my intentions are good, but I might get it wrong. So being self-compassionate, I think, as leaders becomes a really important process, and being compassionate to others is really important too. So there's lots within this kind of notion of recovery, which I could, you know, I'm sort of glossing over really. I could spend a lot of time unpicking what these actual words mean, what these concepts mean, how important are these concepts, because, you know, I'm very mindful that they don't just become words. They're just, you know, this notion of partnership doesn't become a word. This notion of leadership doesn't become a word, or compassion doesn't become a word, because my background is sort of values-based practice. Is about how do you turn values into behaviour, because, you know, we know to our cost in health services, you know, lots of people with really good public health values, but their behaviour doesn't sometimes match that value set. So it becomes important to sort of tie these things together and think about what is the process by which we tie that together. So so these are important things around recovery that maybe have some resonance within the workplace, and will certainly have some resonance in terms of responding to, maybe we can call it a mental health crisis in the workplace. You know, those numbers of billions of pounds that we are in effect losing, I guess, because we are not fully and purposefully addressing some of these issues. When we know we can, and you know, Richard Layard's sort of, who did a lot of the work around the initial work around CBT and working on this notion of helping people back into work, you know, articulated it as being a moral issue as well as an economic one, because he said treatments, there are things we can do, there are treatments that are available, there are things we can do. They're not necessarily sort of treatments in the medical sense, but there are things that we can do that are evidence-based that we're not doing, and that becomes a moral imperative. So, and I think that's kind of really quite important to hang on to that as well. There are things we can do to respond to these issues. We should do them, and we shouldn't necessarily be afraid to do them, because, you know, much of them are associated, I think, with our sense of common humanity, and not about a significant intervention from a formal medical service. That's my timer beeping there. Stop. Okay, stop.
Thank you. So can I just ask the two questions that I wanted to ask then, and that is, we've got Rushi on the team with us as well, and we've got a little initiative going on at the university called Resilient Lincolnshire. So question one is, how can we get you as participating organisations to engage with us, to enable us to actually look at resilience in Lincolnshire, and how we can create some good case studies of what good organisations are doing to make them more resilient for the future. And the second one is, in terms of the mental health productivity pilot, how do we get you engaged so that mental health isn't a stigma that people don't want to raise within the workplace, but it becomes a positive attribute which enables you to actually think about how you create that formula into increased productivity and performance within the organisation that you work in. Thank you. Rosie, I think you're on mute.
Sorry, good morning. Yes, we thought about that ahead of the webinar this morning, and we have a couple of examples of that. Benedict Heaver and his organisation have been thinking very much about the mental health and well-being of the individual people in their organisation. So we will be able to cover that in due course, and that the introduction to Benedict Heaver was actually made by Ruchi Agarwal. So in many respects, we've been doing some collaboration around that ahead of today. So just before we go on, did you actually want someone else to answer that question now, Dean, or would you like us to take that through into the next section?
I think it's potentially rhetorical, but if people want to answer it as they get into the discussion from the audience, I'm more than happy to hear their thoughts, and I'm sure Rishi would do too.
Okay, so would you would you like us to transfer that into the discussion when I hand over to Mark? Would that be okay for you?
If you would, that would be
okay.
kind. Thank you.
That's great. Well, just ahead of that, we've just prepared a couple of questions anyway, especially in the context of the COVID lockdown and the way in which the restrictions are now being lightened, so that I've been into workplaces now where the reintegration is already happening. So how do you perceive that organisational leaders need to develop in order to support and enable the people in their organisations to be the best that they can be?
So do you want me to go first?
Yes, please, and then Ian, and then we'll be passing on to Mark.
So I think I'm picking up on a trend within organisations that are happening at the moment, in terms of there is a move to recognise the right of people within the workforce to actually speak up. And within the NHS, for instance, they've created a freedom to speak up guardian in every NHS organisation, deliberately designed to encourage people to speak up about the issues that are causing them concerns and anxiety. And it's actually an interesting phenomenon that if you can resolve people's early anxieties, then they tend not to develop into full-blown mental health challenges. So the quicker and more responsive and more proactive you can be as a leader to engaging with the voice of your workforce, the better, and to allow that workforce to have a legitimate voice to express their concerns and to listen hard and listen with interest and compassion, and try to actually think about the workplace in the eyes of or in the experience of the person who is trying to tell you about it. And for that reason, there's also a large trend in organisations at the moment to do what's known as reverse mentoring. So allowing individuals within the organisation, particularly from minority groups, to actually share their experience of what it's like to be at the end of your leadership, to be the recipient of it, so that you can gather that feedback and change the way that you provide your leadership to make it a much more effective, constructive and supportive type of leadership.
Thank you. Thank you. Yes, and that actually reflects some of the work that I've been doing with CEOs of international organisations. They've been doing that. They've also sought the voice of the individual people within their organisations, even with regard to the notion of reintegration, because for some people it's their intention to work from home as much as possible as we move forward. So thank you very much for that. Ian, what are your thoughts on that question, please?
Well, I'd certainly echo what Dean was saying in terms of, I think listening is really important. Being open to listening, and we have in our values-based world, we have a principle called the squeaky wheel principle, and this is this notion of, when do you ever pay attention to your supermarket trolley? You only ever pay attention to it when it's not working. And actually, values-based practice is actually being attentive all the time. to not waiting, and I think there's been a comment in the side chat there, which I think is really pertinent, about how do we intervene before things get too much, before the wheel sort of jams, before it gets so annoying that you have to take it back and exchange it for something else. So it's about the sense of being attentive to the squeaks in your organisation, I guess, and you only get that through listening. It is that idea somehow that leadership is about being open, but listening to what's going on, attending to it, intervening, or creating conditions in which interventions can take place. It doesn't necessarily have to be a leader that intervenes. It is about, and again, we start entering the world of sort of really nebulous concepts like culture. But nonetheless, that's kind of where I would promote some real thinking at a sort of board level about the culture, and where does culture come from? How do we influence the culture? And I go back to my earlier comments around teams. Personal view, I think teams are a fantastic engine room of culture.
Yes, thank you. Thank you. And when we're inspiring positive change, what sort of things do you think that we could perhaps signpost these compassionate leaders to do in order to, again, right now respond to the notions of reintegration of individuals into workplaces again? Or because what I'm very much aware is that for some people, they do need to return to their workplaces, whether it's restaurants, whether it's hair salons. So what do you think would be a good idea in order for those people to think about the individuals within their organisations?
So again, it's an interesting piece of research that the Association of Insurance Industries did. Something like 87% of all staff that had been put into a situation where they were now working from home, when asked the question, would you prefer to continue working from home or come back into the office, actually said they prefer to continue to work from home. And that was a major challenge to my thinking. They thought that people would probably want to be getting back into the workplace. And the double challenge that came from that was, it changed the paradigm of the leadership, 87%, but it also then raised the question of, so why then the other 13%? Why do they not want to continue to work from home? And so a secondary supplemental question then had to be asked. And it was an important question, because what that then revealed was the minority view. And that actually brought out a lot of the psychological safeness issues of working at home. And we, as a work group working at home, need to be considered for our vulnerability as this is our new workplace, just as much as it is important for us to consider the office or the factory or the lab or wherever as an environment for safe working. So further intelligence needs to be gathered on an individual basis continuously. One of the things that I'm learning from this is that whenever you're dealing with leadership, you've got to actually put the individual at the heart of your thinking, and you need to gather intelligence at the heart of that process. So, like I said, the digital economy is going to come to our rescue in some regards as directors to help us to understand the complexity of that Vuca world. The digital economy is also going to come to our rescue to help us to understand the complexities of our own workforce. So, for instance, I know of an organisation down in Bristol called Teacup, which stands for Thinking Critically Under Pressure, who have designed a a tool which Exeter Council are using, which is monitoring the psychological safeness and well-being of every one of their employees, that is monitoring it such that each individual is able to have an interaction on a daily basis with their leadership to enable them to know how well they're feeling, how well they're sleeping, what their anxiety levels are, whether they've got other concerns in their life. And as a result of that, they're able to listen much more effectively, much more intelligently, and that rich data could only be enabled through technology. And so, yet again, technology will disrupt our lives into the future.
Thank you. Ian, what are your thoughts to add to Dean's, please, in the context of that?
Yeah, well, I think as usual, I'm only ever going to build on what Dean says. But I think there's something about what can we do to really make a change? Well, one is think about a notion about wisdom, being wise, thinking about what is the right thing to do. What's the wise thing to do, and courage, the courage to do it, and compassion is based on this idea that we often use the word compassion similarly in a way like empathy, but empathy is a very different word. Empathy is about the notion of understanding another person's position, that sense of listening that we were talking about, that sense of communicating and talking. And sharing and trying to take what's it like for this person, and so that sense of empathy, sort of almost stops at that point. Oh, I understand how you feel, but compassion is actually a commitment to act, and that's the difference in some respects, and that's where I think it has some real resonance within commerce, if you will. It is that commitment to act. Now, if we're going to make that commitment to act, to do something to help somebody, to, for obviously for mutual benefit, then you need some courage. You need some courage to act, but you also need some wisdom on how to act in a useful way, because we can all be courageous, and we could be courageous very foolishly. We could put ourselves in danger, we could put other people in danger through our what we perceive to be, some people would say courage, other people would say is foolhardy actions. Wisdom is about avoiding foolhardy actions. But the most, I guess, within that, in terms of what we can do, it is that sense of wisdom, it's that sense of courage, but it's also that sense of commitment, that commitment to be helpful, not harmful. I think that is, whenever we're working, it is that sense of I want to be helpful. I don't want to cause harm. I want to get this better. Now, some of the times we're going to get it wrong. We have to be self-compassionate. We have to forgive ourselves. But we also then have to be compassionate towards. I don't know whether that helps at all.
No, that's very good, because that also then links us, as I'm about to hand over to Mark Hammond. So thank you so much, both Dean and Ian, for your contributions this morning. What I'm very much finding and encouraging leaders and individuals within those organisations to do is to hear and act upon the perspectives of the people in their organisations. If actually going into the workplace is better for them because their own home isn't conducive to home working, then sometimes it's about those reasonable adjustments. It's about the reasonable adjustments if people have a diagnosis of a mental health condition that they didn't have 3 months ago. So thank you so much for that. I appreciate your contributions, both Ian and Dean. So thank you, and we'll hand over to Mark.
Okay, thank you.
Well, that's certainly set us up for a rich and robust conversation for the panel, which will build on the themes and we'll certainly build on the themes that have come out from the presentation, and it really sets us up nicely. We've got 2 questions to pose to a panel which is made up of Dean, Ian, then Reverend Alan Robson and Rushi. And those questions, I'm going to encourage the panel as we have the next 30 minutes to discuss these issues. We're going to take all of the points that were just raised and the research and take a academic perspective to it, which is bring it more into a context of the team. So what does this mean for the individual in an organization? There's a huge emphasis on leaders at the moment, but how do we help individuals in organizations and in day-to-day working life to become part of that support network? So while leaders are taking responsibility for well-being, the first question we're going to introduce is what should the individuals be doing to raise awareness or take responsibility, A, for themselves, but also for the benefit of the whole team? The point being here, given everything we've just taken, I'm not sure that any one leader is going to have the capacity, agility, or resilience to deal with the complexity and pace of the issues that are coming. So how do we enable the support system in that being the team, which in some ways may be a significantly underutilized resource, given the issue of dependency? Let's put it that way. So I'm going to open it up to the panel, and I'm going to start off with Rishi. If you wouldn't mind just giving us your comments and thoughts and building on what's being said. What do you think individuals should be doing to raise the awareness, take responsibility for the benefit of the whole team in their work context?
Mark, thank you so much, for having me on this panel, and thanks to the Chambers of Commerce for organizing such an enriching talk this morning. Dean Ian, it was a wonderful session, so thank you for setting that base. I'm most impressed by conversations around resilience in Lincolnshire, especially by this context that you have set today. I used to use the word Vuca in the talks that I was doing on leadership and the university's role in it. I never realized we would be in such a big Vuca ourselves, that the word itself has changed in its complexity and meaning from the way in which it used to ever be used. So I think we need to, very important point, that we need to realize how truly volatile, uncertain, and ambiguous this world we are in, is. So just very quickly, my background is mostly corporate, for those of you who know me, and wonderful to see so many known faces here today on this, on this forum. So I'm going to speak more from a practitioner perspective than an academic, because Ian and Dean have done a wonderful job of setting the pace of that model. However, just from a very practical perspective, to answer your question, Mark, I think we need to go back to the fundamental of, we keep saying leaders have the responsibility, and how many leaders can they be to take care of everyone's mental health, and identifying it early, as Chandra put that question very well. I think we need to revisit the question, who is a leader anyway? In an organizational context, is it the person bearing that badge? Is it the person with the authority and the corner room? Is it the person with the stamp of approval of the organization to be a leader? I think we need to carefully consider, especially now, the concept of the definition of leadership. And in my experience, of course, without being in such a big VUCA world now, especially so, a leader is someone that people choose to follow because they can't go alone where that person can take them. Now, if that is the definition, the leader is in each one of us, hence, which is a concept that has unofficially been followed, but now it's probably time to bring it out, is rotational leadership. That everybody in our context, especially in this tech-driven world where we're not face-to-face a lot of the time, everyone is a leader because they can do what the other can't. And hence the devolved responsibility of leadership becomes very important, that while the tone is set at the top, which still is important because the tonality, the culture is set at the top, the responsibility of rotational leadership becomes very, very stark. And if each one of us believes that we are leaders in our own rights because the other can't do what we can and we can't do what someone else can, then it becomes spheres of leadership, multiple spheres of leadership within the organization, replicating and branching out, and hence multiplying the positive impact that a leader tends to have or is expected to have, and hence the responsibility of taking care of everybody within that value chain becomes everybody's responsibility. So I just wanted to start at this point of who is a leader anyway in these times.
And beautifully put, Rishi. I think that has landed it fairly and squarely in terms of how an organization can thrive and be agile and resilient when there is shared accountability. in addition, what sits within what you're talking to is a shared context of the organization, rather than possibly waiting to be told or waiting to be given that context, and how leaders can share that context as one tool of building this shared understanding and awareness and devolved responsibility. So this idea of rotational leadership is a key one and a great foundation for continuing the conversation. So thank you, Richard. That was some really insightful points there. I'm going to move on and just come to Reverend Alan Robson and ask if you wouldn't mind giving your thoughts and perspective based on your insights and your work, Reverend, if you wouldn't mind adding to the conversation.
Well, thank you, everyone, and thank you, Dean, Ian, and Rishi. Excellent thoughts that are very generative of other thoughts. I've got pages of notes here. Life thrives through relationships, and somehow I think we've lost that in many layers of society. I think that power of relationships, thriving relationships, healthful relationships, and we've almost forgotten how to just be, to slow down, to reflect. And I think through this period, the discussions that have been going on Zoom and have helped us to listen a little bit more carefully to one another. Somehow, both Ian and Dean, you talk about curiosity, compassion, courage, and I liken that to having a bigger open mind, a more generous open heart, a more generous open will to believe we can make changes. And somehow in the political arena, the economic arena, the public arena, we've almost forgotten how to have that ability to breathe and connect. And it's that interconnectivity which I think has been missing. This sense of reciprocity is the fancy word, I suppose. How do we share equally with one another with integrity, dignity, all those words which can be very slippery. There was a piece of research with 100 CEOs, what is the most important thing that should happen in your organization, or what's the most important dynamic? And these CEOs put at the top of the list self-awareness. And over the years, 20 years, 30 years, I've been working in Lincolnshire. I don't know if it's intuitively the organizations I've encouraged, such as the EPIC building on the Lincolnshire Showground. EPIC has almost been forgotten as it represents 4 words, which are going to be very important in the days ahead. And I think they need to be put underneath the EPIC building. Is environment. It's about people. It will be about innovation, but not just ordinary innovation technologically. It's innovation in all our systems of how we relate. How do we provide safe spaces in our businesses, in council, in every area, and choices, and how we make those choices going forward. So the EPIC building was not just an environmental building on a Lincolnshire showground that cost 7 million. It was meant to be generating a sense of valuing people, valuing young people as they look around food and farming, but equally, how do they take their place in a world that's going to have huge challenges ahead? And the other charity I'm involved with, Green Synergy, which is a city farm next to the hospital, using nature as therapeutic for people to just connect. And there are all sorts of people who use that facility for healing and reconnecting. And sometimes I don't think of it as recovery. I almost think of it as resetting the disturbance that has become part of their lives. And that resetting happens individually, quietly, as they do some weeding in that corner, but it happens as they eventually emerge and begin to value the relationships that are around them. There was an autistic gentleman, he was weeding, and I was introduced as chair of the charity, and he just looked up at me and he said, his first sentence, "It's all about egalitarianism." And I sort of, but actually it was a little bit of wisdom in what he was saying. You know, what he was saying to me is, "You're no more important than me," and he's absolutely right. Yeah, I just have a different function within the team, and he's part of the team as he weeds the grounds and does other things with his colleagues on the site. Diversity and inclusion really matter, and they've come to it's not a trend, it's how we become more human, more open, more respectful, more generous toward each other. So each of the organizations I'm involved with, EPI, Green Synergy, and Lincolnshire Rural Support Network as one of a number, it's about developing those real values of, I often think poverty, it's not an original thought, it's nothing to do with money, it's the lack of aspiration. You know, the lovely Martin Luther King, I listened to one of his speeches the other day, and he talks about, you know, we've been told to pull ourselves up by our bootstraps. And we hear that a lot about people who live in the deprived wards around Lincolnshire and Lincoln. Yeah, but if they don't have any shoelaces, there's, how do we enable that to happen? So in all the areas I've worked with in the last 20 years, and I like the conversation about resilient Lincolnshire. I was on a Zoom yesterday with local authority people, and they're looking towards having that type of conversation, Dean. So I think it'd be really useful if we could make some linkages there. So I think wisdom, curiosity, compassion, courage, open mind, open heart, open wills needs to become the mantra going forward. How do we let go? How do we enable people to feel alive and purposeful in our workplaces, in our charities, in our institutions?
Wonderful.
Thank you.
Thank you, Reverend. That was another really powerful and insightful lens to bring to this experience. What I'm taking from that, just as a quick reflection, is there's something in moving away from just doing and finding a healthy experience in slowing down to experience being through connection, through relationships, through interconnectivity, and within that experience, finding the integrity that is related to self-awareness, which is vital for both members of a team and for leaders. How they experience that rather than just think it is a very different approach that's starting to emerge even with my client base. I'm seeing leaders having to step into space to work with other people to enable their creativity through psychological safety by making themselves vulnerable and talking in that way to allow people to come on the journey with them rather than just trying to flog a story. So there's a real richness in here which has absolute resonance back in the working world. And the other person I'd like to come to is Ben. Ben, I would love to hear your thoughts on this. If you could take us through your experience of this.
Yeah.
And if you'd like me to repeat the question, I'm more than happy to, but my sense is you've got it.
Thank you, Mark. Thanks for having me on. I feel very humbled, firstly, to be on with all these people. Our journey, well, my journey started probably about 4 years ago on this, and started from a place really of the business going through expansion. We're a software company, second generation, so it was set up by my father and things like that. And suddenly we started to get this new cohort of people into the organisation who, you know, the only way I can term it is just didn't really get it. So I think back to, you know, points that Ian have made and things like that, actually one of the most important parts of my job is I'm responsible for the culture, the organisation, and yeah, there's probably a whole conversation that can be had around that and things like that. But we started off at this sort of employee experience and how you know what were they seeing in things like that. And fundamentally, the first thing that we looked to change was this reaction that we were getting from everyone. And I think, you know, this sort of goes back through some of the old sort of business school and things like that, that people were wanting stuff to be done to them. And we said very early on, you know, actually, you know, you've got to take responsibility. So of your development and things like that, that's your responsibility. We will facilitate it and things like that, but we put the responsibility back to them. Now, because I'm from a software side, a lot of my reading has sort of taken me over to the Silicon Valley and things like that. And the Americans have a great term for it, in that they talk about areas of responsibility. So one of the things that we've done internally is when we actually draw out our organisational structure, we draw it upside down. So I sit at the bottom and it goes up, and we talk about it being like a tree. So I'm nothing more than the roots, adding the strength, and actually as we go out to the teams and things like that, they're the branches. And actually that's where the decisions need to be made. They need to be made where the most knowledge about the problem is, not passed completely up the tree, you know, following this idea that, you know, because of someone's job title, they're somehow more entitled, or they've got a better idea about how all of that works and things like that. You know, we used to joke about it internally, you know, did I have a different version of Google to everyone else, you know, because that's how traditionally, you know, we're taught at school and things like that, you know, that if you don't know the answer, you go to the teacher and things like that. And so from an early age, it's sort of built into us that there's that sort of deference to authority and things like that. So we've really looked to sort of turn that on its head. And that sort of took me off to read a book by Satya Nadella, the head of Microsoft. So, you know, they've really turned a corner. And one of the big things that he sort of introduced to me, and I was sort of looking at sort of 3-4 years ago, is he said he turned Microsoft from a know-it-all organization into a learn-it-all organization. And I think, you know, people have talked about Black Lives Matters and things like that, but also mental health and things like that. If you come at it from a point of view that you don't have the answers and that you're curious and things like that, then, you know, you can listen to things. So, you know, to bring it back to the sort of mental health side of things and things like that, you know, we see that as part of the culture and stuff like that. And I was getting very frustrated 3 years ago where people, you go to business places and people would be talking about this generation that was hitting the workforce, that wanted things very differently and things like that. But actually what we were finding within our organisation was, if you just actually listened to them and you spoke to them and things like that, they weren't that different. They wanted a purpose. They wanted, you know, they probably weren't so much involved in this deference to hierarchy that had gone before and things like that. Actually, they just wanted, you know, they wanted to feel that they were making an impact and things like that. But then the flip side of that, you know, you've got that in the workplace and things like that. And people then start to talk about the whole person. Well, if you talk about the whole person, you've got to take the good with the bad. And I just reflected on my my background and, you know, going through your 20s and things like that. You know, it's sort of moving out from home. We take on a lot of people straight from university. So we've got a lot of youngsters going through the organisation. So, you know, they're going through sort of first relationships, maybe sort of first big breakup, you know, they're getting married and things like that. And, you know, both positive and negative, but these are all stresses that are coming on there. And sort of looking back on my past, actually, you know, things that are talked about today, I went through a sort of, you know, single sex school, and, you know, you were taught not to talk about these. And looking back on that to me was very unhealthy. And so whilst we provide private healthcare to all of our employees and things like that, and there was a mental health provision and things like that, there was a gap, you know, that, you know, people weren't thinking about it and things like that. So when I first sort of started talking to Ruthie and Rosie about this, the idea of the sort of mental health was just to, you know, the only thing I could do as a leader was to make it something that you could talk about openly within the organisation without the stigma. And that's all we talked about, that we just wanted to facilitate that thing that people could become, you know, notice that, and it was okay. And actually, you know, there was a provision there, and we would stand behind them, and there would be no stigma behind it. But actually, you know, just like how we train up our first aiders in the office, if someone's got a broken arm, we aren't trying to fix it. You know, we're going to phone up for an ambulance, or we're going to take them to a hospital or something like that. You know, the same is with mental health. You know, I think there's this thing, people feel that, you know, mental health is something that, you know, other people have got experience of, and you don't need the expertise, which is wrong. So we trained up 4 people internally to be mental health first aiders and things like that. And the positives of that, and, you know, the transformation that they've led within the organisation, you know, I've had little to do with it other than to say, look, this is important to us, and, you know, these people are there for you. So it's been really, really positive as we've sort of gone into this lockdown and things like that. Ironically, one of the things that was stopping us going into lockdown, going into remote working before lockdown, was a concern about people's mental health. You know, people living alone and things like that, if they didn't have contact with people and things like that. So we focused a lot on trying to use technology with the video and things like that to make up for it. But yeah, I just think, you know, you've got to start from that idea of turning the structure on its head. I just come back to it's about doing the right thing by people. I think the litmus test for it is, I've got 3 young children, and, you know, what world do I want them to live in? You know, would I want them to work for our company and things like that? And so I think if you start from that side, you know, you're onto a good ground. But the thing is, it's a journey. I wouldn't say we're there. You know, I was very humbled when Rosie and other people have spoken about us as, you know, being moving along this way. I think it's also about being very genuine. I think people pick up on gimmicks and things like that. You've got to really believe in it, and you've got to do it in a meaningful way. So, you know, to bring it back to business and things like that, we look at people's well-being and stuff. So how do we get people to exercise more and things like that? Well, we could give everyone a gym membership, but then the problem we've got there is, well, one, I'm telling people how to spend their money, but secondly, only the people who are interested in going to the gym go, and probably the ones that we wanted to affect don't. So instead, we look at things like running a step challenge, where we link it up with our charitable work. So everyone in the organisation gets at least 1 day off a year to go and volunteer. They can, you know, it doesn't have to be anything to do with the business or anything like that. They can choose it. But we tie it up into this step challenge that they go through for a month and things like that. And actually at the end of the month, if they complete 10,000 steps on average a day, we give them an extra day's holiday. And we get much better participation in that. Actually, the cost of it to the business, yes, there is a cost because there's an extra day's holiday and things like that, but they're having fewer sick days and things like that. So, you know, I think it is important. You've got to be able to explain it. And I don't want to insinuate anything, but, you know, because my father's an accountant, but, you know, it's normally the financial people that would be the sort of naysayers in this. But you can quite easily go back and show them the cost of recruiting and things like that. And yeah, to me, it's about developing the individuals, and, you know, the mental health is just a piece of that.
Wow, that's been a really insightful. It's been really insightful into the process that you've taken for your business to, in a way, demonstrate how you can apply a lot of the concepts we've been talking about. Turning leadership upside down, putting the context to people, involving them, engaging them, recognizing their needs. There is if you step back and you look at the conversation today, there's a clear structure of what you can do, whatever business that you have and whatever you do for your teams, in applying some of these themes and patterns that we're talking to in a very real, robust and pragmatic way. So Ben, thank you. That was hugely insightful, informative. as to how you've done this in organizations to the benefit of your individuals, and then clearly to the benefit of your organization. So thank you. I'm just conscious of our time, and that's been my observation, personal observation, is I'm sitting here feeling very humbled by the breadth and depth of the conversation and just what has been spoken to by all of our participants. So Dean, Ian, Ben, Reverend Alan Robson, and Rushi, thank you so much. That was very interconnected and, as I said, a very rich and diverse discussion across a range of topics which are overlapping and systemic in their approach. We did have one more question, which is what are the future themes, issues, and activities you are seeing or expect to see that will shape our future workplace? I have absolutely no doubt that that question has been answered in many different ways. So I'm actually going to go back and listen to this webinar again, just to pull out some of the richness in this, because it was hugely informative. As we're coming up to 10:49, and there may be some questions, I'm going to hand back to Simon at this stage, but I'd just like to finish by saying thank you again to all of the participants today, whether you are attending the webinar or whether you are involved as a panel member. It has been hugely informative and insightful and a very rich conversation. So thank you to everyone. Really appreciate your contribution and your willingness to give up your time, given the importance of this issue. So that's enough from me. I'm going to quit wittering on. I'm going to hand back to Simon and say, Simon, the floor is yours, sir.
Okay, so I'm tailing the event today, and the opportunity when I started was to get audience participation as well. There has been a chat going on, and we're very grateful for that interaction between the individuals that have partaken in that. There is an opportunity now, just before we close, we've got a few minutes left in terms of the schedule for anyone that's not so far participated in the chat or feel that they want to put something to one of the contributors today directly to do so. If you want to do so, two ways to do so, one of which is by putting up a hand in the, use the participant bar to put up your hands and virtually let us know you'd like to do so. Or just in the chat box, please put a chat there and we'll open your mic and you can put those directly to today's guests. Before that time period runs out, what I would like to mention to you is the next steps that we'd like to go through, in terms that we've set up this series to focus on leadership and well-being. We are launching a survey today to give us evidence about those next steps. One of the things about a survey is it can be out there. It can look like a huge monster in terms of the time it will take to undertake the survey itself. We don't intend this to be so. What we would like to do is make sure we get as much participation as possible to allow us and inform us on the next steps the Chamber can take, along with the partners that we want to be involved in those next steps as well. If you could, we would ask you to share that as widely as possible in order for us to get as great a participation as possible. That will be out, as I say, later on today, and we'll send it to all participants on this webinar and wider as well. Now, I do see in the chat box that Bill, I think you'd like a quick word. So I'm going to give you the opportunity either of opening your microphone, bottom left-hand corner, and mute yourself, or I'll mute you. I think you are unmuted. So Bill Skelly, please take the floor for a couple of moments, if that's okay.
Yeah, thanks very much, Simon. I'll keep my comments to just kind of a minute, really. Thank you for the Chamber for organising this, and yeah, it's such a rich discussion and so many really positive contributions. From my perspective, I suppose I see things in two ways. The first is, what are our issues as a county? And Chandra really kind of said at the start, in terms of how are we going to prevent the escalation in mental health issues that we see as private and public sectors across Lincolnshire County, and using the networks we already have, but foreseeing that the tsunami of issues that are going to fall upon us as relaxation continues and people come to terms with perhaps the loss of a livelihood or the loss of a company that they have invested their entire lives in, and their ownership and the responsibilities they feel to their employees. There'll be very different views across the county as to, and very different perspectives depending on your position. But what I can say from policing is that unfortunately we're already seeing increases in mental health issues, unfortunately in suicide, and we can predict that this is going to be a significant problem for us as a group of communities. So my plea is that we put our minds to how we work together to get early intervention up and running, whether that's business support, mental health support, financial support, and a lot of that has already taken place, but we are still not yet at the real impact that this is going to have. So we shouldn't feel that we should delay that at all. And secondly, I suppose my perspective about my own organisation. We've obviously had a lot of stresses in relation to delivering policing during COVID-19, but prior to that, for the last 3 years, we've really looked at well-being in 4 parts, and many of those have been discussed already, but being healthy, so your physical health, being happy, your emotional health, you know, you should be happy at work, you have a right to believe and to enjoy your work. Being valued, so the psychological and psychiatric support that you have in terms of your mental well-being, and then being connected, being engaged, and that's been said, and Alan said it, the purpose, and so did Ben. What is the purpose of your participation in this organisation? And if you feel strongly aligned to that purpose, then you will be more resilient in your physical, emotional, and psychological well-being, all of which makes good business sense, but really at the end of it means that as an individual, you will thrive and not be damaged by your experience at your work. And we've certainly done lots of different things in order to try and promote that across the organisation. And my final comment being, the leadership role I see as one around creating those environments. Create the environment for people to be physically well, create the environment for them to feel engaged and have a purpose, create the environment for them to have psychological support and feel valued, and create the environment where they can be happy. And if we succeed at that as leaders, then we can go home and sleep at night. Okay, thanks, Sam.
Fantastic. Thanks, Bill, for articulating those points. That's really useful in terms of this context as well. We've got a couple of other points in the chat forum as well. Now, there's one there from Janine, which is excellent, and thank you for putting that in. Do you want to say any more about that in terms of putting some more context to it, or people can read it there? I'll unmute you and say yes or no whether you would like to say any more. Oh, I'm trying to unmute you. I'm struggling to unmute you.
Am I on? I'm not entirely sure.
You are on. Yeah.
Okay. Hi everybody. This feels a bit weird because it's the first time I've actually done any corporate for 3 months. So yeah, furlough is a really, really odd experience for those people that have devoted so much time and energy, and it's how we actually, I can already feel it, the 2 disparate groups, is how we actually work towards acknowledging the value of both groups, and making sure that those groups don't last in disparate way that they are currently for too long. So it's almost recognising that there is that there, acknowledging that it's okay, and then finding a solution to it, really.
And thanks for raising that, Janine, because it is a challenge that I think people know is there, that we've not really come to address it at this particular stage. So whilst I'm not suggesting I've got an answer to that, I think raising the issue and for us all to be aware that that's something for us to have on the radar to look at in future is really important. So good to hear from you, and thanks for articulating that. Just because of time, I've got to move on now to Rushi, who's just asked for an opportunity to say something as well. So Rushi, please come in.
Sam, thank you. I think Dean had his hand up just to possibly react on this very point. So Dean, do you just want to go quickly?
I was just pointing out the fact one of the articles we produced right at the beginning of the pandemic was don't lose the opportunity to educate and reskill people who are furloughed, keep them engaged through giving them learning events, one of the differences between this potential recession and previous recessions is people have often entered the post-recession period and not trained people. This one is different because a lot of organisations have invested in things like this, educating and redeveloping their workforce.
Oh, that's a great point. Sorry, Simon, I gave it to him because his point was related to what Janine said. So I thought it was a good one to have. So just very quickly, what I wanted to say is, such valid points made. So much that's being done. We heard from Benedict, on what he's doing with Streetskeeper. We heard from Janine on, how she feels and how she's investing her time. To me, and of course, we know the whole resilience, model and how so much in the county, as Bill says, what's the impact on the county? And Dean referred to it earlier, but I think there is a great need for us to capture these stories of resilience, to capture these stories of innovation, impact, giving, utilizing time, space. And if we don't capture them now, we will lose them forever. We look back at 1918 and see what's done, but I'm not sure what was captured in terms of learnings that we can take so that we are resilient in the future. What are we giving our future generations when they look back at 2020 and say, look what happened in that pandemic? And as a county, we can get together and collect those stories, look at them from afar, create learnings and inspiration for future generations. I think we have an opportunity that we collectively are sitting on today. And if we work together and collect those stories, and I'm trying from the university very hard to get ourselves a digital board where, it's wonderful. It's like a Mosaic board where we can all just upload our stories, look at it, create inspiration for students across the universities and schools and even primary schools, but also ourselves learn that if ever we find ourselves wanting to look into 2020, look back into 2020, we have them capture of what Lincolnshire did and how resilient it was. So there's more on that coming, and I hope we'll work together with the Chambers of Commerce to bring that alive. But my point, just the last point, is that I think we need to remember not just to live through it, but to capture it as a legacy.
Fantastic, Rushi. And unfortunately, that's 90 minutes gone. That really has sped by this morning. So it's been enjoyable. It's been thought-provoking. It's been inspirational as well. So thank you for that. Just one further plug for our ChamberConnect series. Look out for the next events that are coming up on our website, links-chamber.co.uk/events. 6th of July, we've got a How to Have Difficult Conversations workshop, and on the 14th of July, Thinking of Exporting are the next two webinars that we've got coming up. If you've got any further ideas or comments on the back of this webinar, events@links-chamber.co.uk is the email address to send things to. For now, because we've run out of time, I'd like to thank once again Dean Fathers, Ian McGonagle, Ben Heaver, Reverend Alan Robson, Rishi Agarwal, and my two co-hosts, Rosie Green and Mark Hammond. Thank you all very much for joining us, and I hope you have a very productive rest of the day. Thank you. Bye-bye.